Hello there, I'm Dr. Jim Collins. Thank you for stopping by. I have a great topic because it affects so many people. It is successfully dealing with depression. Now, we all experience things like sadness, loneliness, and grief at times, and they usually last for short periods or short spells. We would consider those, acute episodes. They're normal emotions. Everyone experiences them. There's nothing wrong with it whatsoever. But when these feelings last for more than a month or 2 months, then there might be some type of clinical depression. And we need to pay attention to the symptoms and how long they last and how many times they pop up during the month, right? And you're looking for symptoms like anger, irritability, anxiety, obsessive thinking. You can't get thoughts out of your head. You go to bed and you just think about the same thing over and over again. That's not healthy. And of course, if an individual is thinking about death or suicide and being preoccupied with that, then there might be a big issue there, and we have to take that seriously. Now, one of the most potent forms of depression is major depressive disorder, and this means a severe lack of interest in things that you love to do, work, school, hobbies. You don't want to get out of bed. Your hygiene suffers, and it carries a hefty suicide risk with it as well. So major depression has to be addressed by a mental health professional. It can severely impact a person's occupational, academic, and personal life. Now, the good news is this: a combination of antidepressant medications and other types of medications, counseling or therapy, and something I really find beneficial is self-help. You take a combination of that and you can lead to two major outcomes. Number one is managing your symptoms. And the second one is improving and enhancing your quality of living. People can live with depressive symptoms while they are minimizing them and while they are living a full life. So don't give up. There are many things that can be done for sure. Antidepressants, I'm sure you've heard of antidepressants like Prozac, Effexor, Celexa, Zoloft. They can be effective. Not every med helps every individual, but they can be effective by interacting with the brain's neurotransmitters and helping those neurotransmitters like serotonin, norepinephrine to do their job even better. Now, remember, there are always side effects, and you have to monitor those side effects and take them very, very seriously. Most will be short-term. They'll be done in 2 weeks, and you move on with life. Some GI problems every now and then. Now, counseling, therapy, short-term hospitalization might help as well. Some people don't necessarily want to get into therapy. They think there's a stigma behind it, but once they do, they realize how liberating it is to share your problems with another human being that is there just to listen to you. So I always do recommend it. And self-help, I'm a big fan of that. Keeping a daily routine, paying attention to your nutrition, eating an anti-inflammatory diet. Getting sleep is extremely important. Exercise and health, having a very healthy social network of people around you. I believe in the power of prayer, meditation. The attitude of gratitude is a wonderful thing. And I also use in my life very heavily music and art, and they help with moods all the time. So while millions of Americans are experiencing depression right now, millions of Americans are going to experience depression. There are so many things that we can do. Don't give up. There's always hope. Thankfully, and I'm going to end on this because it is a powerful statement, it has been found that depression is the most treatable psychological condition there is. I'm Dr. Jim. Take care. GoPro, stop recording.